Good morning, ladies and gentlemen. We would like to start the session now. So, I think for this session, I would like to maybe we can organize in a way that the presenter, like first three, after completed their presentation, then we can go for a Q&A session, and after that, again, another three, then the overall comment will be that last. So today's presentation is about gender inequality, disability or different label people, or the way we mention them, and inclusion, social inclusion. So maybe we will learn something from the presenter regarding the inclusive sanitation. Actually, I would like to start with a question. I'm not sure, it's like not more female audiences here. Being a woman, we always struggling in a way that, okay, when we go outside in our work or in public area and wherever, in a school or anything, so we always struggling mentally and physically about only one thing, I think, is about toilet. So whenever we have a conference today, I'm not sure how many women now are struggling when they're in their working place. So today's presentation maybe give us some insight to upgrade this situation. So first of all, I would like to invite first presenter, Mr. Nuhu Amin, to present his presentation. Thank you.
Thank you everyone for being here, and thank you Professor for allowing me to stand here. And today I'm going to present about a very familiar issue that we may know, but the way we are going to talk is how we are going to quantify them. There are many data available around the globe on toilet hygiene and functionality, but there are lots of lack about how they have collected the data. Before I start my presentation, can you just let me know how many of us in 2024 visited a government hospital? How many of you visited government hospital and stay there like for treatment? At least like outdoor visit. No one in Bangladesh. So where you are from? United States. So you understand why we didn't go there. One of the major reason is hygiene, and also like you will not get chance to get a facility. So my talk will be a little bit aligned with that, but why it is important, because we have to achieve JMP by 2030, and there are, I think there are some technical issues is like automatically changing the slide, so I'm really apologize for that. I'm not changing anything. So, okay, I will try to fix it. So in this slide, you can see that toilet functionality and cleanliness depends on lots of factors, including functionality, cleanliness, availability of the people. Like there are JMP definition, JMP ladder, toilet to users ratio as well. And the crowding is one of the biggest problem in our country. Like in the left side of your photo, you can see hundreds of people actually queuing in the outdoor service, but they are not sure what should be the toilet to users ratio. And also you can see there is no standardized regulations for what should be the toilet to users ratio in different wards, different indoor and outdoor, and also whether it's actually measured according to the operation theater, medicine ward, gynae ward. Do you have that type of data? And answer is no. And recently, like in 2023, we have published one paper during the COVID-19, and the ratio was during that time is 1:60, for government hospital. The ratio was really high. But during that time, the place was not that much actually crowded. So the question we have asked that what is the current toilet functionality and cleanliness in our country, particularly in a large hospitals in Dhaka city, and also like what are the factors that can influence the toilet cleanliness and functionality. So you can see the distribution of the hospital that we have selected for this study, and it was a cross-sectional study. So H1 to H10 is the government hospital, and P1 and P2 is the private hospital. So we selected 2 private hospitals. And though the government hospital and private, so everyone is like more than 250 beds. It crosses 500 beds up to 500 beds. So these are like big hospitals in Dhaka. And we collected the data on like toilet observation, hospital records, and like use like mobile phone for collecting this data. So briefly, the definitions that selected toilets and toilets blocks, because we defined the hospital as a toilet blocks, not as a blanket, we didn't collect the information in a blanket way, because there are different heterogeneity within the hospital. So apart from the toilet census, actually, we included every toilet that is actually accessible for us. And the toilet users is defined as any individual present at the hospital on the day of data collection and who might expected to use or desire to use the toilet. And the toilet block is a single toilets or multiple toilets within the healthcare facility where users, where those are used by specific people or a specific group of people, either patient or caregiver, patient, caregiver, or staff mix, or staff exclusively. So in this figure, you can see that, sorry, this portion, you cannot see this figure. So there are very much different departments within the hospital that have toilet facilities in different departments. So we have segregated the data based on blocks. So if it is only patients block, then how many patients using the toilet in that block and how many toilets in that hospital. And if it is used by mixed like patient and caregivers and hospital staff, then what should be the number of mixed user toilet. And also, if it is only for patient like staff, what should be the number of staff and toilets. So this is also gender segregated. We have collected data gender segregated as well. So for availability, we have collected, as I mentioned, all the toilet we have included. And functionality, these are the parameters like pan and commode functionality, latrine door, current user status, whether it is used as toilets or it's used as like storeroom or other, and availability of the water, we also assisted in each toilets. Toilets to users issue, one of the biggest critical things we have also assisted that we check the register that how many people actually available in that day of our visit. Patient, we ask patient how many on an average caregiver present during that day of data collection. And also we discuss with the nurse that what should be the average number of people come, visitors come every day in each ward. So the number of toilet in this 12 hospitals was really varied. Like toilets, highest toilet number was found in hospital 1 is 430, and lowest was 43. In both of them are in government hospital, and these are the distribution. We are successfully able to cover like 86% toilet we are able to observe. 14% couldn't observe because of locked. There was no person. Those have tables. So all the data is related to this observed hospital from the next slide. So out of this observed hospital in government and private hospital, in overall, less than 70% toilets are functional among these toilets, and 35% were clean. So it is really, really dramatic that it's very much like hygienically is not good, that toilets are, majority of the toilets were not clean. And the distribution of H1 to H10 was the government hospital, and P1 and P2 is the private hospital. And they have almost, functionality is also almost very much similar within the government hospital, but in private hospital, the functionality is a little bit improved. And why? What is the reason here that the toilets are Like you can see that in the below, the ratio for patients was really staggering, like 200 patients actually use one toilet, including their caregiver. But on the other hand, the right side, someone, you cannot see it. So staff actually underutilize the data. One staff use one toilet. Staff use one toilet. So distribution, toilets are there, but the staff and toilets are not actually utilizing that very equally. And these are the distribution of the toilets in outpatient service and inpatient service. So it's very clear from this graph that outpatient service has very high number of like users, like 264. We found like about 900 users in one outpatient toilet. So so this needs to be actually considered. Like I know WaterAid is actually providing toilets, like portable toilets, and that portable toilets can be one of the solution in the outdoors, because constructing new toilets cannot be a solution because there is no storage, like sufficient space. So we also distribute this functionality and cleanliness depending on the patients, mixed users, and actually also like staff. And there is also like mixed user toilets are always been not clean most of the time, and also like lack of functionality over there. And one of the most important things in this is a diversity, like gender equity, like 70% basin were functional and 64% basin were clean, like hand washing basin. So there is also lack of basin, number of basin, and among those basin, those are actually not functional, and only 13% basin had soap in government hospital, and 29% basin has soap in private hospital. Less than 1% toilet with ministerial hygiene management, and less than 1% toilet with disability. So ICDB has some innovation, like how can we improve the soap dispenser, like how can we improve the availability of the soap. So we have developed some soap dispenser here that can be actually hold large amount of soap without refilling for 1 week at least. So we have that model. Also, there are lots of model on like availability of the ministerial material. So you can just utilize the paddle bean and also like booth for the ministerial pad, and also like simple intervention with wheelchair and the railing in the hospital toilet that can increase the situation. So in conclusion, I think it's we found very low number of people that is hygienic and no soap within the toilet block. So infection control is one of the biggest factor, I think. So in IPC, in our country or globally in LMIC, toilet hygiene is not considered as a IPC material because it's considered that only doctors and nurse hygiene is actually considered. So this should be integrated with the overall IPC. So this is one of the recommendation, and we need to increase the number of toilet in outdoor, and also increase the function, like regular maintenance and facility improvement should be there for upcoming future directions. So yeah, thank you very much for your patient hearing, and this is I'm happy to take any question during the question and answer session. Thank you very much.
Thank you very much. Mr. Nuhu Amin, he is now a PhD candidate under Dr. Juliet Lovis mentorship. Okay, thank you very much. Our next presenter, I would like to request Mr. Khalid Hasan, MD Khalid Hasan, for his presentation. His topic is about toilet functionality and cleanliness in, it's the next one, I think. Yeah, sanitation's role in girls' school attendance. Thank you very much.
Good afternoon, everyone. Thank you for being here. My name is Mohammad Khalid Hasan, and today I'll be presenting my research on sanitation role in girls' school attendance, exploring the impact of gender-sensitive wash in Rohingya refugee camp. This is a conceptual study aimed at addressing a critical gap in refugee education and sanitation policy. Let's start with the context. Over 1 million Rohingya refugees resides in overcrowded camp in Bangladesh, creating one of the world's largest refugee settlement. These camps face severe resource constraint, particularly in education and sanitation. For example, only 40% of girls aged 12 to 18 attend school according to UNICEF 2022. Cultural norms, safety concern, and inadequate facilities contribute to this low attendance. Just 30% of school have gender-sensitive toilets, leaving most girls without safe private sanitation. But why is this study so important? Let me highlight a few critical issues. Menstrual hygiene management, MHM, only 29% of adolescent girls have premenstrual knowledge, and just 8% have good knowledge, according to Plan International. Half of the women use clothes during the menstruation, while only 17% use disposable sanitation pad. Many feel uneasy using dignity kits, which was basically introduced by UNICEF due to a lack of privacy and cultural stigma. Menstrual waste disposal is a major issue, with girls burning, or throwing used product into toilets, leading a clogged pipe, faster peat filling rates, according to Plan International. Impact on education: Rohingya refugee miss an average of 1 to 3 school days per month due to menstrual pain, lack of access to product, and stigma. Cultural beliefs such as fear of evil spirit further discourage attendance, increasing dropout rates and early marriage. Overcrowding. In many areas, a single toilet is shared over 100 individuals, leading to severe overcrowding and inadequate privacy. The problem is clear: inadequate wash facility hinder girls' school attendance and overall well-being. My study aimed to explore how gender-sensitive wash infrastructure can improve girls' education. Especially, I hypothesized that improved sanitation could increase girls' attendance by 20 to 30% based on evidence from similar context. Let's look at what existing literature tells us. Educate 2017 found that improved sanitation facilities in schools increased girls' attendance by 20 to 30%. Similarly, Al Yusuf 2020 showed that introducing menstrual hygiene management facilities in Syria, refugee camps in Jordan led to 25% increase in girls' school attendance. These studies highlight the importance of addressing health and safety concerns to promote educational access for girls in refugee settings. The study proposed a mixed method approach combining quantitative and qualitative analysis. Quantitative data would be collected through survey of 500 households from 5 different camps, focusing on school attendance, health, wash facility users. Qualitative insight would come from interview with at least 20 NGO workers, educators, and community leaders. Random sampling would be used for household, while purposive sampling would give guide interviews. For analysis, logistic regression would assess correlation between wash access and attendance, while thematic analysis would identify barriers and facilitators. Based on existing evidence, this study projects several outcomes. Improved wash facility could lead to a 20 to 30% increase in girls' school attendance, a 15% reduction in health-related absenteeism, a 10% reduction in safety concern, and 30% reduction in dropout rate among adolescent girls. This projection aligns with findings from similar contexts, such as which I mentioned, Syrian refugee camp in Jordan. There are a few recommendations. To achieve this outcome, I proposed 4 key recommendations. Design a gender-segregated toilet with MHM facilities, separate toilet for girls and boys to ensure privacy and safety. Although there are few examples where in few schools there are separate toilet, but that is not number is not enough big to impress. Including menstrual hygiene management facilities such as disposable bin and access to sanitary product. engage the community in wash planning and maintenance, involve refugee communities in the design and upkeep of wash facility to ensure cultural appropriateness and sustainability, partner with NGO for sustainable infrastructure, collaborate with non-governmental organizations to implement and maintain wash facility, leveraging their expertise and resource, advocate for increased funding from NGO, use the study finding to lobby for additional fund. Unfortunately, the slide is missing here, so which is why I'm just explaining. And finally, advocate for increased funding from NGOs, use the study finding to lobby for additional funding from international organizations, ensuring long-term support for WASH initiative. To conclude, this conceptual study highlight the transformative potential of gender-sensitive WASH facility in Rohingya refugee camp. By addressing sanitation barrier, we can promote girls' education, health, and safety, contributing to broader development goal. Thank you for your attention.
Thank you, Khalid. Khalid is an undergraduate student now in university, East West University, I guess. Okay, now our next presenter will be Sonia Shahid. She is an senior governance and service delivery expert in the field of water, sanitation, and housing, based in the Dhaka office of Athena Infonomics.
Thank you, everyone, for attending my oral presentation. So we began this study to really understand the challenges that municipalities face. So, for example, many municipalities right now are facing financial resources that sort of lead to, not adequate service delivery, inadequate infrastructure and sanitation, as well as insufficient technical support that leads to governance issues as well. So, looking at these challenges, looking at these issues, we selected 5 municipalities. The way we selected the 5 municipalities is all 5 have an FSTP, a functional fecal sludge management service delivery system, as well as they were Class A municipalities. So when we were doing this study, I'll first delve into the methodology and how we actually did the study. There was a sample size of around 1,150 households, which was equally distributed within the 5 municipalities, of course. And we had the way the households were selected, so there was low-income community households and non-low-income community households. And the way it was selected, we had a confidence interval of 95% and a margin error of only 3%. So it's pretty representative of the study areas. So when we talk about vulnerable households, what we actually mean by are the poorest, people living in slum areas, people with disabilities, and in some cases, female-headed households that don't have a lead male head. So it was a mix of research, both qualitative and quantitative. In terms for the qualitative research, we did workshops with local government officials. We talked to manual mechanical emptiers. We spoke to public toilet operators, masons, anyone who has any role to play in the sanitation portfolio was interviewed. We also did FGDs with households. We also spoke to national level government officials when we conducted this study. So some of the topics that the questionnaire looked into was the service delivery model that they were following, the financial flow model, enabling environment, the solid waste, fecal waste, wastewater quantification, and other areas, operation maintenance requirement, capacity building issues, social mobilization, and support to informal workers. I'll just move on, and for the in-depth data collection, some of the areas that we delved into was the demographics, access to toilet, municipal finance, institutional structure and accountability, regulatory and governance mechanisms. We triangulated the data we got with reconnaissance visits, where we looked at sanitation hotspots and verified the data that we collected in the FGDK, IDI, and the survey. We looked at the functionality of the on-site sanitation facilities, which helped us to develop the shit flow diagram, and as well as collect photos. There were 5 frameworks that we used to do this study. The service delivery, the city service delivery assessment, CSDA framework. We used the political economic analysis, the Swiss framework, the service outcomes and the system functions, the shit flow diagram, and a waste flow diagram. So the results. Moving on to the results, when we look at the city profile, sorry, I made a bit of a change to make it clearer, but to ye hoye acha. Okay, nonetheless. When we did the political and economic analysis, we looked at the level of interest of each influencer with the level of interest that they have in the sector of upgrading, improving the sector. And we categorized them. Now this helped us to inform, to conclude, to recommend on which stakeholders to involve during the dissemination and when developing interventions for the cities, and which stakeholders to sort of involve in different capacities, as in information data collection, or to actually involve them in consultations. So that's and then we did the economic analysis, and you can see a comparison here of the 5 cities. For example, you can see the FSTP capacity for 5 of the cities, with Technaf having nearly 26 KLD capacity, and this is not very clear. Okay. Sorry, yeah, Technaf having 25 KLD, and Saidpur having the highest 26 KLD, and the lowest being Shokipur, 4 KLD. It's a small city. So we also have the utilization rates for each of the city. So this is like a basic economic profile, but we go on further to do more analysis comparing each of the cities as well. So when we look at the Swiss framework has 3 service outcomes: safety, equity, and sustainability. So like you can see in this slide, the citywide households have access to toilet facilities. You can see citywide households dependent on community or shared facilities. LIC households that have access to individual household level toilets, as well as medium and high income household access to individual toilet, and then compare it across the cities. So I'm not going to take too much time here. I just want to focus on one slide here, where it shows, sorry, I'll just move on here, inequity. When we talk about equity, manual and mechanical emptying, you can actually see that the percentage of pit latrine that is manually emptied is higher than the percentage of mechanically emptied pits, whereas the fees that is paid for manual emptying is lower than the mechanical emptying. Now, and also the safety, the safeguards that is provided to the manual emptiers is also missing. Then we can see that the number of LIC households that have access to safe IHHL is somewhat lower than the number of households that have access to safe IHHL. Now this is because of having that treatment plant and having functional vacuum trucks that are servicing the city. Then when you look at the staff, the female permanent staff versus the female contractual temporary staff. Now there is a big discrimination here, because contractual staff among the female members is higher than contractual staff among the female permanent staff. So most of the permanent and top level employees in these Poroshobas are male. But like, if I want to just focus also on one city, which is Lalmonirhat, which doesn't have any female, Technaf. Technaf doesn't have any female permanent staff, 0. It's all male permanent staff. And then Lalmonirhat has put in quite an effort to improve the number of female staff, but they could not do it in terms of having permanent staff. They could do it in terms of having contractual staff. Contractual staff were mostly women who would clean the roads, sweepers who would clean the roads, or work, people mostly in the payroll, the master role. So yeah, so the effort that they put actually resulted in having more female staff, but really in the master role, not really in the among the permanent staff in Lalmunriyat. However, Soitpur has a high number of female staff. Now, having said that, Soitpur having a high number of female staff, Soitpur itself has very small team of workers. So compared to Lokhipur, which has about 100, which is a 100-member staff Poroshobha, Soitpur is about 25 staff Poroshobha. So overall, if I can conclude that female members among Poroshobha staff is very low. But again, because we have a 30% quota for committee members, council members in female, it's always 30% there. So it's a bit messy. Now this is safety versus, what we have actually done here is we did an SFD for the whole city, and we did another SFD for the low-income communities only, to look at how equitable the service delivery is in the whole city. So when you look at Saidpur, the first city, it's 34% across the whole city. And it's about 33% in low-income communities. So we can conclude that service delivery to the poorest community is very equitable. One of the reasons why this is equitable is that low-income communities enjoy a discounted rate for desludging, and some institutions, for example, orphanages, don't actually have, mosques don't actually have to pay for desludging. It is given free by the Poroshobha if they make an application to the mayor. Lalmunriyat, you can see, is 17% and 14%. So low-income communities enjoy a bit less service delivery facilities than overall the whole city. So again, this calls for more targeted intervention where the low-income community can actually enjoy more services like desludging services and safe containment systems through targeted interventions that the city can take, or subsidized tariff rates, or scheduled desludging. So when we look at Teknaf, when we look at Shokipur, it's 35 and 33. It's more or less at the same level, whereas being in the low-income communities is 2% less. So again, low-income community enjoys a little bit less service delivery.
Make it a little shorter now.
Shorter, okay. Yeah. Lokhipur is the only Poroshobha that has a higher, higher safe service delivery to low-income community, which is 44% versus the whole city, because Lokhipur actually does have poverty reductions, poverty support plan that they actually execute in the city for the poorest communities. Moving on, so in terms of sustainability, the O&M cost of the sanitation infrastructure, you can see that the O&M cost is covered only 5% for Lalmunriyat and 7% for Teknaf. And when it comes to sanitation investments covered by budget line government transfers, Lokhipur is completely covered by government transfers. Lalmunriyat is fully covered by government transfers, whereas the other cities actually need external grant injections. This is the CSDA. In terms of the service functions, so responsibility, accountability, and resource planning, management and planning, we have actually looked at all the indicators, data points that relate to responsibility, and did a weighted average across the 5 cities. But so in terms of responsibilities, the city have a index of 0.7 out of 1, which is pretty high. Being said that we do have bylaws, we do have a separate regulatory framework for fecal sludge management. However, when it comes to accountability measures, we do not have a performance tracking system in the country. So the scale is a bit lower, 0.25 out of 1. And in terms of resource planning and management, although we do have a significant amount of investment that are being injected into the Poroshobhas, it is, to the extent it is being implemented, is something that needs to be looked at. So where the level is at 0.53%. So, yeah. In conclusion, the study actually helped in developing a political will for the cities, and is sort of the study that is actually leading to developing strategic service plans in sanitation for Poroshobhas. Thank you.
Thank you very much. So I would like to open the audience now. You can have a seat now. Can you change it? I would like to open the for Q&A session for first three presentation. If you have any questions for anyone, like Nuhu Amin, Khalid, and Sonia, Shahid, any question from the audience? Yes, please. For whom? Nuhu Amin. Okay. Please.
Bhai, thank you for the presentation. I saw your previous presentation in another forum. I'm not. It's in the policy support branch. You showed another presentation, but I was just keen to know about the government hospitals that you have mentioned and the private hospitals. Are they all in the metropolitan city or in the municipalities or other? Like there are three grades of municipalities in Bangladesh: A, B, and C. If any of the hospitals are from those areas, because the actual condition in sometimes it's found that the scenario in those areas are kind of more difficult than the metropolitan areas. So what's the
Yeah, thank you for your question. I think these all are city corporation, like North and South City Corporation, and yeah, like these all are very big hospitals that we every day go. And among these hospitals, we have found that this is a very short presentation, so we have published this in PLOS ONE as well, and this has been uploaded in WHO website as well in WASH in healthcare facilities. So the major problem we found is like leadership is one of the biggest challenge. If the leader is very strong and he has the understanding of IPC and WASH, the toilet cleanliness very much improves. So yeah, so that's one of the challenge. Any question?
Any further question for Nuhu Amin? So whenever you ask question, please introduce yourself. So in my one, I have one question. Okay, just to learn from you actually. If you mentioned in a slide that mixed use toilet is not at all clean. So any suggestion for that from you?
Actually, in real world, there should not be any mixed use toilet in healthcare facility, particularly in low and middle income country where there are lots of violence during night or during different days. The problem here, since there are very scarce of toilet, whatever those may be the gender segregated or for patients or staff segregated, but the problem due to very much scarcity of the toilet, they allow everyone. And the recommendation is definitely you have to increase the facility. You see the space.
We keep mixed use.
No. That's not the recommendation by any authority. Yeah.
Thank you. So any question for Khalid? Khalid? For no, for maybe Khalid, can you?
Yeah, sorry, last time I didn't
He's not here,
introduce
yes.
myself. I'm Hossain from Practical Action. I'm
Khalid is not here, I think.
Oh.
Okay, he like to avoid the Q&A session. Maybe.
Okay.
It's good because he is an undergraduate student. We know. Okay.
No, there was a, if anyone from his friend circle, there is anyone.
Not really. You can say
So
to
just
Khalid
one
later.
recommendation. That's not one recommendation
Would you
because
please introduce
yeah,
yourself?
I'm Hossain. I'm working as technical specialist in Practical Action, and I'm working in the wash and sanitation sectors around 4 and 5 years. The thing is that there is an already existing MHM national strategy. There's been developed by Practical Action with the support from UNICEF.
Okay.
So if anyone can go through that strategy, it would be helpful for any kind of
Okay.
research purpose. Also, WaterAid is currently doing the working on the MHM platform to standard that thing. Any student or who
Sure.
are interested.
If I
think-
find Khalid,
yeah.
I will introduce to you.
Okay, no problem. Thank you.
Okay, thank you very much. Sonia Shahid, any question for her? Any question for Sonia Shahid? The last presentation we had. If not, I have a question for you. You can come here. Okay. Regarding your findings, what we have seen over there, okay, it's kind of, you have short of time. You may not explain it clearly. You took like some municipalities over there. Like those are like, have you find any locational impact or because of location? Because you select 5 cities. you must have some justification regarding that. But I want to see any kind of location, because municipalities here, or any kind of spatial requirement or social aspects that impact because of the location. Any findings from you?
Locational impact on
O-
gender?
on gender, because we are, yeah.
On gender. Yeah, of course. Okay, first of all, the 5 cities were selected because all had functional FSM service delivery. So not all municipalities have FSTP plant or desludging service. So we intentionally selected these 5 cities so that we have a functional FSTP, we have a functional vacuum trucks there. Secondly, yes, of course there are issues. Like, for example, when we talk about TechNav, I actually showed you that there was no permanent employee in TechNav Poroshobha. Now, this is one of the reasons which I actually found was that the area itself is very conservative. And women, like I was talking to a few entrepreneurs there, women usually do not feel respected to become job holders. So it's kind of like a household thing where if you are working in a Poroshobha, you're not a very respected person. So this was opinions that came from the ground, as opposed to other areas like Soitpur or Shokipur, where they actually, Soitpur actually has female accountants who are very encouraged and work very freely in the Poroshobha. But having said that, I want to sort of highlight one incident in TechNav where we had a consultation, like a group consultation with private waste enterprises. There are about 8 enterprises in TechNav, and all 8 enterprises, there are 9 wards, so one entrepreneur got 2 wards. They collect, daily they collect waste from households. So among the 8 entrepreneurs, there was 1 woman. So I asked her.
So what's your recommendation actually regarding that?
So this is my recommendation. So I asked her, so what made you come to this job? Because there is no permanent employee, like this is a, so she said that she had been in a UNDP project, and then after the UNDP project closed, she was actually encouraged by the mayor of the Poroshobha to take up managing this enterprise because the mayor saw potential on her. She just finished her HSC. And so the mayor said, take up 1 enterprise, and I want to give you 1 ward to manage, and see how you do, just test out the waters. Now she's the best performing entrepreneur there, and the best. So she's a very accomplished girl then, very respected as well. So I think it's, yeah, leaders. Leaders can change social taboos.
Okay, thank you. Thank you very much. So now I would like to go for the next presentation by Tazeen Hossain. Tazeen Hossain is a development facilitator with over 20 years of experience in the non-government development sector. She will present, her topic is unintended consequences, the unforeseen adverse outcomes associated with the formalization of fecal sludge emptying services.
Can you hear me properly? Thank you. Very good morning to all of you. I'm Tazeen. I work with Practical Action as Head of Program Delivery and Operations. And it's really great honor to be here and share our experience with you. So before starting, I would just like to know how many of you have septic tanks at your home? Can you raise your hand? Septic tank. So do you know that you are managing sewerage in a safely managed system? Do you know? And how your septic tank, how you are managing the sewerage from your septic tank? Is it legal or illegal? Can anyone respond? You do not know? Okay. So for your information, actually 70% of the sewerage in Bangladesh are straight going to the drains or canals or river. And do you know that who have pit latrines or septic tanks, who are actually cleaning those, who do not have illegal connection? Who are cleaning our septic tanks or pits? Do you have any idea? Sweepers? Okay. So in this 2025, we are calling them sanitation workers. We are not calling them sweeper. So yes, that is just a kind of brainstorming and like trying to actually know what your experience in Bangladesh. So in practical action, actually, we are working with sanitation workers for more than last 2 decades, and we have been trying our best to provide the dignity and equal wage, and also other services like health insurance, life insurance to the sanitation workers. So, and also we are trying to provide that type of new technology and safety gears to the sanitation workers so they can have less health hazard in the system. So actually, we have conducted a research jointly with ITN-BUET, and the title of the research was Unintended Consequences, the Unforeseen Adverse Outcomes Associated with the Formalization of Fecal Sludge Emptying Services. So many of the NGOs or INGOs, we have been working so that the job of sanitation workers become a formal job, so that they can use new technologies, they can get different services, better wage. But at the same time, when we are formalizing their job, they are actually having positive result and also some negative results. So through this research, we wanted to know that what is the situation. So if we like look into the background, in any formalized workforce should have existing sanitation worker remain employed, sanitation workers' income increase, workers use mechanical equipment, workers accessing protective equipment, workers being respected in community, and workers having agency and voice in issues relevant to them. So this is kind of a very, like what I should say, standard situation of a formalized worker should have this type of like facilities or service. But we are not sure whether our sanitation workers are having it or not. So we actually conducted this research to understand the role that sanitation workers organization can play in improving sanitation workers' lives and livelihoods. Whether the sanitation workers, they can be organized, they can form their own platform. So how that is going to improve their situation. So that was one of the objectives. Another objective was to understand the current trend of formalizing the sector on workers, working condition, and livelihoods. That we have started formalizing their job, how it is impacting their working condition and livelihoods, that actually we wanted to know from this research. So we have actually conducted qualitative analysis. We conducted 12 FGDs covering 96 sanitation workers, and we also had discussion with 10 municipalities representatives and NGO staff. We conducted 10 KIIs. And while selecting those sanitation workers, we actually tried to identify them from various diverse type of employment modalities, like who are supported by NGO support from and private company, and directly employed by local government or through a cooperative, or someone who are employed by local government with sanitation investment ongoing, someone from employed by LGI without sanitation investment, and somewhere operates as a private sanitation worker. So we tried to have that diverse group of sanitation workers in the while we have done those FGGs. So what are the research findings? So, and we have actually selected 10 municipalities. So these are the name of the municipalities where we actually worked. And what are the major findings? What we have found that the sanitation workers supported by NGOs, they are actually having positive outcomes. Suppose they are getting different like safety gears, or maybe health insurance, or better dignified life, maybe through different awareness raising campaign, or working with municipalities. The sanitation workers are getting more respect in those areas. And also for sanitation workers, okay, so without, another finding is without deliberate consideration of an intervention impact on sanitation workers, multiple negative outcomes were also found. We have also found that when we are formalizing their job, there are some negative outcomes. So what are those? Formalizing the sector can result in negative impacts on income, earning potential. So when we are formalizing their job, we have found that the income has reduced compared to their previous approach. So informal manual workers fear mechanical dislodging will result in their income decreasing. So what actually the sanitation workers found, that if they use mechanical dislodging, this will decrease their income. Why? Because in that system, they will be working with municipalities, and municipality will get some portion of that income, and also the they cannot cover many people through that mechanical dislodging, but they can, if they do it manually and they can connect personally, they can income more than what when they are using that mechanical dislodging jointly with municipalities. So these are few negative consequences that we are facing. So we had some quotation, Mike. I think this is the previous presentation. I think that is missing. So so what are our findings? So we would like to, from this research, what we would like to share that national level sanitation projects are needed and formalization should be progressed, but how it is implemented really matters. Previous national level sanitation projects funded by international development banks has resulted in harm done to horizon sanitation workers. Introduction of mechanical dislodging equipment has come at the expense of income for sanitation workers. And government and development banks are encouraged to partner more deeply with the NGO sector to understand the process that led to these unintended consequences. Funding bodies and government offices are urged to introduce condition into upcoming sanitation projects to avoid repetition of these harms occurring. So these are few findings and recommendations that we like to provide to government. And also, we think we need to have more research and study to understand what are the implications we are bringing, and how actually any initiative is impacting their livelihoods, income, and also the social acceptance in the community as well. So more research study will be required in future. So thank you very much. And if you have any question, I can answer. Thank you. Yeah.
Thank you, moderator, for the opportunity I have to present the work we did in Kinshasa. We worked on sanitation workers to see how are their working conditions and the implication of this work on public health and their welfare. The study was conducted in Kinshasa for a master's degree thesis for one of our students in 2022. The title is Health Risk, Knowledge, Attitudes, and Practices of Sanitary Workers or Operators in Kinshasa, DRC. We can say that the knowledge, attitude, and practices of sanitation workers are very important to inform intervention which can help to improve their working conditions and better mitigation of health risks related to fecal sludge management. And when it comes into our cities in low and middle income countries, most of households rely on on-site sanitation. We were asked how many of us are using septic tank at our household. We have raised our hands, and we can see that those who are emptying those septic tank or offering the emptying service are most of the time neglected or overlooked in our communities. And whether they work manually or hired and working on a vacuum truck, they are often at the front line in maintaining hygiene and sanitation in mega cities of low and middle income countries. But when we see the effort which are made to improve the working condition of those people working at the front line for disease, to reduce disease transmission in our communities, health workers, those who work in health facilities, benefit more attention. But at the community level, we have those sanitation workers. And the gaps in their knowledge, attitudes, and practices can increase the risk of disease transmission and environmental insult, so environmental pollution and whatever it can bring. During COVID, it was found that when the disease transmission at the community level from human to human could be less, but the virus was found in sewers or in excreta, so it could be a better way to for surveillance of diseases. So the working condition need to be improved. And this study was conducted to assess the current state of knowledge, attitude, and practices related to the health risk among sanitation operators in Kinshasa, DR Congo. And the study was conducted to assess to inform behavior change intervention that should be based on evidence related to the caps of sanitation worker in order to be effective in substantially improving their working conditions and ultimately for public health and environmental protection. The study was conducted in Kinshasa. Kinshasa is the capital city of the Democratic Republic of Congo with more than 15 million people and extending on almost 10,000 square kilometers. And the study was designed as a cross-sectional study. As I said, it was conducted in July 2022. It's not 22. The sampling, we sampled 79 independent manually sanitation workers and those work on mechanically working condition on vacuum trucks. We will use snowball sampling technique for the independent sanitation worker because we could not have the list of those people because they are they are not organized and we could not access to their list to sample. Then we went through a snowball sampling techniques. And for those working in, on mechanically emptying services, we selected them through a random sampling method. The principal variables that on which we collected data were the socio-demographic characteristic and working conditions of sanitary workers, and we went also through a standardized questionnaire to collect their perception of work-related health risk and practices. Data were analyzed using mainly descriptive statistics, and we used SPSS for data analysis. And ethical conditions were also, ethical consideration was also taken into account, and the study protocol was approved by the IRB at the University of Kinshasa School of Public Health. The main results of our study suggest that for socio-demographic characteristic of sanitary workers in Kinshasa, most of them are male. Very few of them are female, as we have also seen on those posters at the entrance of the ballroom. I was very amazed to look and read what is posted there, that female sanitary workers are very few of them in Kinshasa. Most of them are male, aged 36 to 45 years, with a mean age of 42. And the oldest of those we interviewed had 70 years. For the education level, most of them were of secondary school level, and most of them are married or living with a partner. About those we selected, the majority of them were working on a vacuum truck, but we had like 44% of those we interviewed, we included in our study, were independent sanitation workers. Their perception of the riskiest time during their work, the majority of them say that it was while they were emptying septic tank or latrine pits that it was the riskiest time for disease transmission. What was their perception of the environmental and health risk associated with their work? Almost 1/3 of them say that there were no risk for disease transmission or health risks, and more than 1/3 of them say that there were not any environmental risk. So it means that they are not well aware of the fact that their work exposed themselves to disease transmission and also the community that they serve. their awareness of the effectiveness of personal protection equipment in managing health risk, only less than 30% of them were aware of that. So it means that they may have using personal protective equipment, but they are not really getting the role of those personal protective equipment in interrupting disease transmission to themselves. They say that they use PPE, most of them, but what kind of PPP they use? They use gloves and boots, masks, but they do not use them on a regular basis. It means that it's random. So, and this can also be explained that they do not really understand the role of PPP in interrupting disease transmission. From those results, that we can see that sanitation operators exhibited low level of gaps in terms of knowledge and some attitude in their practice on health risk associated with fecal sludge management. And the regular use of PPP does not match the claiming on PPE, because they say that they use different kind of PPE, but they do not use them on a regular basis. And we can say that urgent actions are required to improve their working condition and the quality of their service that they provide to the community, and to come to an effective fecal sludge management for public health and natural ecosystem protection. And this will imply that we need more investments in education, resources, and supportive practices to empower sanitary workers in order for them to perform their roles more effectively and ultimately contributing to better health and well-being of our communities. I thank you for your attention.
Thank you very much. Now I would like to request our last presentation presenter, Tazeen Sharmin. She's working in WaterAid. Her topic is about unveiling the gaps in Dhaka's public sanitation system.
Hello everyone. Assalamu alaikum. I'm Tazeen Sharmin Umama. I'm a civil engineer and I'm working at WaterAid Bangladesh as a program associate. Okay. So my topic is unveiling the gaps in Dhaka's public sanitation system. So first I want to say that let's imagine that you are walking in Dhaka city and you are feeling the urgency of using a toilet, but you realize that there is no public toilet nearby. And if you found one, you are seeing that the toilet is very unclean and you're not feeling very comfortable using the public toilet. So this is the everyday scenario for Dhaka city, and there are millions of people living here and they are facing this problem every day. So in this presentation, I will unveil the critical gaps in Dhaka's public sanitation system, mainly focusing on public toilets and focusing on the insufficiency, uncleanliness, and gender challenges. Through this, we will explore why this issue is very serious, and we will talk about sustainable solutions. Okay, so as you all know, that Dhaka is the capital of Bangladesh, and the Dhaka has two city corporations. One is Dhaka South City Corporation, and one is Dhaka North City Corporation. And the total area is 306.4 kilometers square. But the population is huge; it's 24 million, and the annual growth rate is almost 4.2%. And the public sanitation status of Dhaka city is not so good. There are inadequate number of public toilets, and the public toilets are inadequate, and the maintenance is very poor, and there are lack of toilet facilities in informal settlements. Okay, so there are a few challenges. The main challenge is that the overcrowding population, this is the main challenge, and here are lack of investment and the insufficient wastewater and sewage management is also a key challenge, and the cultural and behavioral issues are the one of the major challenges in this sanitation situation. So this, the study objective is that we did this census to assess the condition and accessibility and management of public toilets, and also we tried to identify the gaps and propose recommendations for improvements. So this study actually conducted on 2023, December 2023 to January 2024, and we covered all the toilets of Dhaka city. And actually a team of 10 volunteers did a questionnaire survey, and they visited all the toilets, and they actually interviews and did GPS tagging and photo documentations. So we actually found 607 toilets. If we consider the North City Corporation, we will see that one toilet is for 20,000 people, and and in South City Corporation, one toilet is for 15,000 people. But this is for the total number of toilets. But if we consider only the public toilets, which is not the market toilets or CNG station toilets, then you will see that one toilet is for 75,000 people or more. So this is very insufficient, and in our findings, we actually saw that here are two types of toilets: government-owned toilets and non-government-owned toilets. Here, government-owned toilets means the toilets owned by government, that means city corporations, and operated by leaseholders. And non-government toilets means most of them are at filling stations or markets or bus stands or parks. So you can see that the most number of toilets we found in marketplaces and roadsides. So we actually found 5 stakeholders. One is leaseholders. They have the most number of toilets. Then we saw market committee toilets. Then here are a few individually owned toilets, and there are few NGOs like WaterAid or other NGOs are and some filling stations are operating few toilets, and here are bus owner associations toilets. So here is the overall scenario, overall quality of the toilets. In the perspective of gender, you can see that in the last here, the separate entrance for female is only 22%. 22% of the total toilets have separate entrance for female, and which makes female very unsafe and not welcoming, so they don't actually feel very comfortable using public toilets. You can see the number 10 here is female attendant. That means the operators. So in the public toilets, female operators are very few, so which is also make female users very uncomfortable. They don't love to use this. So there are a few other statistics like toilet tissues. You can see that only 38% of the toilets have toilet tissues, and for soap dispenser, only 51% toilets have soap dispensers. And you can see that nappy changing station, only 10% toilets have this kind of facilities. Okay, so here are some pictures of poor toilet maintenance situation in Dhaka city. These toilets mostly operated by leaseholders of city corporation and individually owned and bus owner association. These are few toilets. You can see the operator is male here, and the location of the toilets are not very welcoming for female users. They don't feel very safe, and the quality of the toilet, it's not very hygienic and not very clean, so they don't feel comfortable using these toilets. Oh, sorry. Okay, so these are a few toilets operated by NGOs. WaterAid Bangladesh is currently operating 23 toilets in Dhaka city, and by their implementing partners DSK, Sajida Foundation, and Bhumijo. And in these facilities, you can see that female attendants are here, and the condition of the toilet, the cleanliness, and the position or location of the toilets are not very like these locations are very comfortable for female users. They feel very comfortable and good to use this kind of facilities. Okay, so we analyze the data through some indicators. You can see that gender segregated entrance, availability of toilet tissue, and so on. So here you can see that the gender segregated entrance here, NGOs and others have 31%. That means, and the bus owner association doesn't have any gender segregated entrance. So in toilet tissues, you can see that availability of toilet tissues in most of those stakeholders. Here are like very few have this kind of facility. The disabled-friendly toilets, only NGOs and bus owner association and market committee has few disabled-friendly toilets, but most of them doesn't have disabled-friendly toilets. Here you can see that nappy changing facility. The nappy changing facility is not available in market committees and or individually owned toilets. So this type of you can see the hygienic surroundings. So here you can see that most of the toilets doesn't have hygienic surroundings. So as I already said that women don't feel very safe using toilets. So when we were surveying, we talked to one of our female user, and she said, I avoid using public toilets because they're unsafe and unclean, and I would rather wait until I reach home. So they don't drink water. Women stop drinking water, so UTI problems and kidney diseases are more often occurring to female users. Okay, so the key challenges, we find out that the lack of monitoring and regulation from the city authority, and the lease document, which is a short period of time. So that's why the leaseholders are not very willing to put any effort for the maintenance of the toilets. The limited private sector engagement. Private sectors are not interested in public toilet facilities. So and public behavioral issues. We know that we use the public toilet, but we don't actually make it user-friendly for the next user. And here is no sustainable business model for public toilets. And the operators who are operating these toilets, they don't have any kind of training, so they don't know how to actually manage these kind of facilities. So the recommendations are, we should actually work with the city authority. We should encourage them to increase their monitoring, and engagement of private sector is very important here. And we should work on some business models, and we should work on some capacity building training for the operators. So why should we consider private management, or why should we engage private sectors? Because if we engage private sectors, better maintenance and cleanliness will be ensured, or financial sustainability will be gained, which is important. So how we can engage the public sector. So here are some suggestions. We can just put some advertising on the public toilets. We can just put some LED screen where we can put some advertisement, and through this we can earn some revenue, and which can make the public toilet sustainable. Or we can take some strategic partners, such as some cleaning companies like Harpic, and then we can just, if we collaborate with them, and they can sponsor some cleaning products which will help to improve the public toilets maintenance. And also this kind of public sector engagement will help to improve the overall sanitation system, focusing on like public toilets. So this is from my end. Thank you.
Some water now. So you should have some water now. So we actually finish. I'm not sure. We are not in time, no? I'm not a good moderator at all. So now I would like to open the Q&A session again for last three presenter. First of all, any question from the audience for Ms. Tazeen Hossain? Any question from the audience for Tazeen? Any question? Sorry, Tazeen Hossain. Sorry, Tazeen Hossain. Yeah. Any question from the audience? No? Okay. Yeah, sure.
So thank you for your presentation. So this is Dr. Nuhu Amin from ITN-BUET. So you mentioned about the terminology of sanitation worker. We should call them sanitation worker. So what is the Bengali of that? How you will call them?
Bengali.
Because you know, for example, in
Yes.
my village, I have to call them in my village that call that person. Like we usually call them method. So how we will call now?
Actually, in Bangla, we are calling them Porichhonnota Kormi. Porichhonnota Kormi.
How this will be actually scale up? Like how people will know that I need a Porichhonnota Kormi. So Porichhonno, like cleaning stuff, is a lots of
So
cleaning stuff.
do you want to use the...
No, this is your field. I'm just trying what should be the operation
So, yeah.
I will use in Bangla.
Yes,
So that's the question.
in Bangla, actually we are and also if you go to the municipalities where we work, they are also now calling them Porichhonnota Kormi. They do not like, we do not want to use sweeper or so that
Previously thought like origin,
yes.
a distinct community was there for.
What my father will call them.
Actually,
He didn't got this message. He's in village. So what is the solution? So that should be actually justified.
Okay, so yes, maybe when this type of platform is a place that we aware people, and also we actually work at the policy level, and we are also developing policies for the sanitation workers, and in the terminology is already clearly mentioned in that policy, right, Tamit? So we have already identified the definition of sanitation workers in the policy. So when government enact that policy, and when that will be rolled out, that will get more coverage, I hope. Do you want to add anything, Mike?
yeah, sure.
Yeah, so Dr. Michael Pousty with Practical Action. I would just add, terminology is important, but when it comes to in the village or in secondary towns in Bangladesh, I still feel that what is more important than terminology is ensuring that the formalizing of the sector results in improved livelihoods.
Okay.
Workers are not going to mind what they are called in comparison as to whether they can feed their children.
Right.
So as long as it is important, but as long as we keep it in context.
Actually. So I
Thank you.
actually have a question for both of you. Actually, I want to learn actually because both of you are working on the sanitation workers' health and things like that. You mentioned that formal versus informal. So what's you have finds that if I make them formal, you mentioned over there that
Yeah.
their income
Yeah.
decrease.
So, who are the formal workers? Like, if some job is considered as formal,
Right.
the worker will get at least the minimum wage.
Right.
So, the minimum wage of our country is now 13,000 to 14,000
Right.
BDT per month. But the sanitation workers, they are getting only 3,000 taka per month,
Right.
which is only $24
Right.
per month. But if they miss one day, they will not be paid for that day. So when their job will be formalized, they will be able to get the minimum wage of the country, and also like other services that is like provided for the from the different other policies like workers' rights, and that is mentioned in other
That's why
policies
you
as
like to say it as a formal
formal
sector.
sector. But
So what about in Congo?
yeah.
Yes, I can also add that when the work of sanitation workers is formalized, it means that social security
Yeah.
will also be involved, and their work will be better guaranteed in terms of ending contracts and things like that, because right now when they are hired into a company offering emptying service for septic tanks, they are like working on a daily basis.
Yeah, daily basis.
When they are sick, they are no more paid. And they can terminate the contract without any payment. And when also they are sick or for a long time, they just lose their job without any compensation.
Yes.
So it means that we need really to make them more
One more
formal.
question for both of you. I like to see the scenario in Bangladesh and also in Congo. The next generation of a sanitation worker family, do they like to go for the same job?
So from our experience, like we have been working with the sanitation workers, like we have already working with more than 2,000 sanitation workers in different cities. We are working in 11 cities at this moment. The situation has improved. Most of the children of sanitation workers, they are now going to schools, college, universities. Yeah. So that type, like what we have heard and what we have seen, that they are not going to that kind of livelihoods, but as they are getting more better job opportunities, and because they are getting education and going to universities and having universities degrees at some level, but we are not sure. We do not have that data. Maybe my colleagues can also add here. But we are thinking about next generation sanitation workers type of project as well, focusing on the children of sanitation workers. So that will be more, what we said, that more mechanized and more safer than what they are doing at this moment.
Yes, in Congo, I can say that most of the time, the social conditions of sanitation workers make them children also most of the time going through the same path, because they drop school, and for those who are male, they can be at an earlier age accompanying their father to his work, so they take over. But it maintains also familial situation at a lower level. So we need really to improve their working condition and wage, so that it can help them educate their children because most of them are not willing to be
Right.
in
Be,
their
be
parents'
the
conditions.
parents' condition, yeah.
Yes.
Thank you very much.
Thank you.
Oh, a question.
Not a question, but a comment, I would say. I think we who are working with the sanitation workers and trying to establish in one hand their dignity and on the other hand to create the work environment, both. So if you all put your hand together with us, join your hands, and we manage to able to improve the work environment first, the conditions as well, and the terms and conditions of their work, ensuring their safety and security. Of course, it will all start with the dignity, the recognition. So if that happens, and we manage to reach up to a degree or level, I believe from the perspective you have raised your question that whether they would like to continue with the same profession as their parents, meaning that the profession that their parents used to have is not enough dignified, enough, not well compensated, not at all. So the overall scenario has to be changed, and for that, all of us are working, and I believe if we manage to convince the policymakers and the implementers, things will change, and at some point of time, we'll reach to that level where no one will feel, uncomfortable being a sanitation worker.
Because my experience in Nepal, I'm not sure whether anyone is here from Nepal. It was quite fantastic. I have seen, I was there in a settlement of sanitation workers, and I just astonished because I'm seeing that it's not a slum. It's a very, very good neighborhood. So I have seen over there. So it's not only about money, it's about the way we think to see people. Thank you very much. Any question for Sharmin? You have the water now. No?
So I have one question to Professor about PPE using. Maybe not, you don't need to answer. So have we tested the PPE according to our context? So we always recommend you have to wear PPE every time, because whether that is comfortable for that within climate change, heat stress, and like sweating, have we wired that and we tested it, whether that is possible to wear? So one question for you, and also like WaterAid or any sanitation worker, because we always recommend, but we never prepared that for them. So that's one of the biggest challenge I see. So I think we have to look up there if we want their safety. For Tahjin Apa, so main challenge overpopulation. I disagree in certain level because there are many countries, particularly Singapore, if you say, population is not a problem. They have the innovation and technology. I would like to draw attention to SARS that we have to design the infrastructure according to the population projection. So that's one of the biggest things I would say. So policymakers needs to actually consider, like construction engineers and the planners needs to actually consider that. So that's one comment I have. And for your presentation, you didn't define the public toilets. Like you also considered that market toilets, so that's a little bit confusing that, if you go to Boshundora city, that's also a market toilet. And that is basically clean. And why I'm raising this, if you consider the toilets during the Hajj, during the Bishwa Istema, 1 million people come and toilet is functional. Why that is functional during that 3 days and why the toilets here is not functional? Because who is actually managing that and how the workforce actually dedicated for that, that's another. It's not a population proportion, it's actually, I would say it's who is actually driving that. I think that's biggest things. One is innovative solution and another is like who is actually managing that, that's important. And revenue from WaterAid toilets that you have, I really enjoy when I go to WaterAid toilet, and this is really nice. I really like that. But how much revenue you are earning so that it can go sustainably after WaterAid left this service, whether it is scalable or not? Thank you.
For sustainability, that's why we're saying that we want to engage the private sectors, and we're working on this right now, because the revenue, most of the, there are like 23 toilets in Dhaka city, but not all of them are in like good revenue. They're not doing good revenue, but some of them are doing. So we're like engaging private sectors for this, and so this was our recommendation. And for the challenges, I made the slide. So there we said that the challenges was not about the population. I said it when it was the introduction part. So when the challenges was the lack of monitoring, the lack of capacity building training of the operators. We are working on this also. So we are building the capacity of the leaseholders.
I have one question. Can you?
Yes, yes, yes.
So actually, one question. My question is, you meant. Oh.
Regarding population density, I would like to mention, WaterAid is working particularly to promote lucrative, not lucrative, usable public toilet or gender-friendly public toilet for the city dwellers since 2014. During that time, we are pursuing with different city corporation, but still availability of land due to overpopulation, it is the fastest problem, prime problem to get adequate land and secured land to construct this toilet. I think all over, within Dhaka city, within Chattogram, everywhere we found this. That's why the development partners or city corporation are not able to construct sufficient toilet. That's why per toilet, per user become more higher. That is one thing. And regarding market, basically, in many countries, we found, except city corporation toilet, many market toilets or shopping mall toilets are allowed to use for the general citizen. For example, in Nepal, with municipal notice, there they selected this toilet will be used for the general citizen. There is a signboard. So we would like to try to find out if there are any alternative measures we have to push the relative city corporation, respective city corporation, to follow this kind of approach.
Okay.
That's why we.
I got your point.
Yeah. Thank you. That's why we assessed all the toilets to see the.
Thank you.
Yeah. Thank you.
So Sharmin, my last question is not question. I want to learn from you that you mentioned about business model. So I would like to see. It's not a service model. It's a business model. Yeah. Could you further explain who is going to do the business with toilet?
It was our recommendation.
Yeah,
that,
I
we
see
need
over
a
there. That's why I want to
model.
learn that who will do the business.
Most
Suggestion from you.
private sectors, if they're like engaging or something.
Okay, you are focusing on private sector. It's not the community.
Most of the public toilets are there.
No, it's not management. I am talking about business model. You are doing business, so it will be owned by the private sector. Okay. It's a very common type, public-private partnership. I don't know if PPP is there, whether there is a business or at all over there, if public is there. So if you like to have public and you like to do business, it's quite difficult being here in Bangladesh. So thank you very much. I really enjoyed the session. I learned a lot from you. So I like to conclude it now. To me, actually, toilet is like this. It's reflect yourself, nothing else. Your toilet is actually who are you. It's not only personally, it's also being within the nation. So when your public toilet is like, it represents the nation. Your household toilet represents you. And it's a very common thing, I think. I like to see, whenever I go outside, two things I like to focus. One, the situation of children and women in that country that represent the country. And the next thing is the toilet that represent the country. Thank you very much.
Session number 6.